The San Antonio Free Market Medical Association is co-led by myself, Shankar Poncelet. I have a medical marketing agency here in San Antonio, and Dr. Roger Moczygemba, owner of DirectMed Clinic, a DPC clinic here in San Antonio. The Free Market Medical Association is based on 3 pillars. The first pillar is price is not a product, care is the product. We want to be able to compare different services and products that represent care, and we want to be able to compare so we can decide what is the best option for us. Which provider, service, or product has the best reputation out there? We believe that whenever that is the case, the question of price falls in place automatically, because that is typically what a free market does. Our second principle is value. Value is established when the buyer and seller agree on a fully disclosed, mutually beneficial price for care. And that ties strongly into transparency. How do we want a patient to make a decision whether they want to proceed with a certain intervention or procedure if they don't know what actually is all included in the price that they are being asked to pay? And that, of course, is closely related to the topic of surprise billing. The third pillar of the FMMA is price equality. And price equality is really something that it represents the idea of everyone can have access to a price. For example, there is a database, Shop Health, within the FMMA website that anyone can go to and enter a certain procedure or service or product in the medical sphere, and then they get a price no matter what health insurance they carry, no matter what group they belong to. And that is very important to the Free Market Medical Association. Now let's try and see how this relates to our main goal of tonight, which is collecting anecdotes for Congressman Chip Roy. Congressman Chip Roy has a plan which he calls healthcare freedom. If you go and look at his website, you can read more about that. It's very, very interesting. For the purpose of tonight, I just want to read the 4 core principles of healthcare freedom to you. The first principle is no one should stand in the way of you and your doctor. That is really something that we all care about very much. We want this relationship between doctors and patients to be back in the foreground. The second principle is employers should have the ability to provide, and you should have the ability to save healthcare dollars tax-free with the ability to spend those dollars how you see fit. That is a very important aspect here as well. For instance, one element that I have seen on Congressman Chip Roy's website is an expansion of qualified expenses under the idea of an HSA plan. The third core principle is here, you should be in control of your healthcare options. You and your doctor, not a list on a health insurance plan, for example. And then last but not least, there should be a safety net to ensure no one falls through the cracks. I believe that is something we can all get behind. And we actually have a group of people here on this call tonight that can make that happen if we work together and if we provide good feedback. We have representatives of legislature, we have doctors, we have employers, we have patients, we have so many people here on the call excuse me if I forgot to name your group, but this is something that is very powerful. And without further ado, I want to give the virtual floor here to the co-leader of the San Antonio Free Market Medical Association, Dr. Roger Moczygemba, who also serves on the Healthcare Advisory Council for Congressman Chip Roy, along with his colleagues, David Balat and Dr. Kaufeldt, who are here on the call with us tonight. Dr. Roger, the floor is yours.
Thank you, Shankar, for that wonderful introduction. I'm really honored to have him as a co-chair of this chapter of the FMMA in San Antonio, and I'm so excited for the progress that we've made over the last couple of years. It seems like we just keep gathering more and more influential people and getting our voices heard more and more, which is a great feeling. You know, we've been working really hard at this to provide this type of value and create this free healthcare economy in San Antonio. And it's always been our goal to get together the right players, which are providers, employers who pay for most of healthcare in this country, and a few brokers that get it. And we are definitely making progress. So that's our goal here in San Antonio, and so much appreciate everybody's help in getting on board and helping us create that. I wanted to talk a little bit about Congressman Chip Roy. He serves as the chair of the Republican Study Committee on Health. He's the chair of the Republican Study Committee Healthcare Task Force. So what this means essentially is he leads the Republican narrative on healthcare policy. So with that, the input that we gather tonight is going to be in the right place. Some of the bills that he's introduced this session include the Personalized Care Act, the Reciprocity Ensures Streamlined Use of Life-Saving Treatment Act, the Veterans Access to Direct Primary Care Act, and the Coronavirus Regulatory Repeal Act. And as Shankar mentioned, he has his Healthcare Advisory Council, which I'm a member along with Dr. Chris Held and David Balat, who are the co-chairs of that. Like I said, the people that we have in this little chapter are growing. The quality is just amazing. Influential people like Dr. Chris Held. She's a board certified ophthalmologist. She serves on several other boards, medical boards in San Antonio. She's the past president of the American Association of Physicians and Surgeons. She's co-founder of American Doctors for Health, and she served on the Healthcare Council for Dr. Ben Carson during his campaign. And her practice, her ophthalmology practice, is completely third-party free. So she has a practice that's a model for what we're trying to do here. David Balat is a nonpartisan research institute director of Right On Healthcare at the Texas Public Policy Foundation. He's a former congressional candidate and seasoned hospital executive, and he's published in the national news media as well. So our goal tonight is to let Dr. Held and David Balat have the floor, and we will let them describe what is needed right now with Congressman Roy, and we hope to, we welcome some discussion about what we'll be talking about. So Dr. Held, David, the floor is yours.
Thank you, Dr. Roger. I really appreciate this opportunity. What a great blessing to have an FMA chapter in San Antonio and in our community. And I became aware of FMA really over 10 years ago, I think, when I went up to Surgery Center of Oklahoma to meet with Dr. Keith Smith and their group. And that was an absolute model for me of the way to provide care directly to the patients, with the patients at the center, making the decisions, whether it be through their employers or on their own as small business owners, not through an insurance company and all the walls and obstacles and barriers that we have all come to know that really are impediment to direct patients directly accessing their care, with all of the principles espoused earlier when we talked about cost and value and choice and putting the patient-physician relationship in there. So it was really a great source of joy for me to discover that. And I enjoyed attending the meeting when we had Dr. Marty McCary there, who I just read his wonderful book. And that was a great meeting. Then we went through this year, which, seems like a year that many of us never thought we'd live through as physicians. And it's nice to be coming out this side of it and have the FMA there to go forward with. And I think that what an amazing blessing it is for us to have in Texas 21 Congressman Roy. And Congressman Roy gets it. He got it before he was a congressman. He was elected because of his stance on healthcare freedom. And I just consider it one of my greatest blessings and joys to be able to know him and work with him and support him in his efforts to put the patient back at the center, restore the patient-physician relationship, and all of the principles that you talked about. So yes, 5 years ago, even as an ophthalmologist and a surgical specialist, I had to, practice what I preached, and I went completely 100% third-party free, including Medicare. And so many of the stories that I have experienced and share with Congressman Roy, yeah, he should be a doctor, he's earned it about now, are helpful in advancing the narrative of why we need policy on the state level, which David Balat can talk about, and at the national level, that will allow us to do the things that we're talking about doing without having just a steamroller going forth for a socialized medicine, government, big corporate, single payer, Medicare for all type of model, which would no doubt be ensuing were it not for people that understood the plight for patients that we're talking about. So we have our Healthcare Advisory Council, and we're very thankful that Congressman Roy has wanted to have this council. And last year we met quarterly, but this year we are meeting monthly. We feel that it is that important and that vital to be meeting monthly with our group of physicians to discuss important issues. We set the agenda and discuss with Congressman Roy and his staff, Sabrina Hancock, who is superb, and the other supporting staff. So we have direct input as physicians in the district. We have input as members now of FMMA to go forward. And in order to go forward in representing us, the congressman needs to know what's really happening in real life medicine, so that when he speaks to his fellow congressmen and the people working on healthcare at the national level, he can explain it in ways that they can understand, so that they can see the failures and the successes and how policy needs to be put forth that helps that. We have all witnessed this last year, how bad government made by bureaucrats, bad policy made not by doctors working with patients directly in the throes of healthcare has not been the best, shall I say that. And we need to put the patient back at the center with healthcare freedom and choice, which is what Congressman Roy wants to do, restore the patient-physician relationship, minimize the money that is taken out to support middlemen in a convoluted system, and streamline this. And one of the ways that we thought that this would be good to do is by providing our true life stories to Congressman Roy and the team. And I think this is a really great venue to do that. And I'm hoping people will report their stories tonight. There's a way to do that written, told, we can do videos, but these are very, very important stories to share from every aspect of the patient-physician relationship and the patient trying to access care. I also think as a surgical specialist doing direct patient care, I would desperately love to know or see resources in our community, in our county in South Texas, in the FMA, of who I can turn to help me when my patients come to me for direct care and want to find direct care from other physicians in other surgical specialties, other medical specialties, and of course, direct patient care. So I'd love to see us also have a great resource that I could go to and share this with my patients and employers, whether they be from large businesses or from small businesses, because as we all know, we get it. This is really the way to go. So one thing is that you may feel like it's hopeless and that we have no input, but through Congressman Roy and his position of being head of healthcare at the Republican Study Committee, which already has a healthcare plan formulating, he has direct input. In fact, he is the person in charge of crafting this message, crafting the policy. And what we have to do is get the message out and get it communicated to the people of the United States, the patients of the United States, so that they can understand it and realize that it's a plan. And this is really important, the messaging and the communicating. And this is what we're asking everyone to please do. So I'll give you an example of a real life story that I shared with Congressman Roy. I had a young patient, 24 years old, who could not, she's works at a fast food restaurant and she doesn't have insurance, and she developed a medical problem, severe headaches, nausea, vomiting, decreased vision. And the only way that she could access care in the middle of the night was at the emergency room at our county hospital. And she was cared for acutely during an ER visit at the hospital and evaluated and treated very appropriately and expediently initially. But then she was discharged for outpatient care. So when she left in the wee hours of, what was Sunday night to become Monday morning, and then Monday went to get her outpatient follow-up, much to her dismay, her follow-up with a neurologist was 6 to 12 months later, although she was still in the throes of a very significant, potentially blinding, if not worse, neurologic condition that needed further workup and treatment. So she was found out about me as a direct patient care ophthalmologist, and I saw her the next day and was able to do testing and diagnosis for a very reasonable price. Everything that I was able to do for her, complete consultation, review of her ER visits, testing in my office for $130, which she was very happy to pay. As we all know, even patients right now who are quote unquote covered, when you have a $5,000 deductible and the prices are egregious, you really aren't covered and people go without care and can't afford it. At any rate, I was able to treat her and she was very happy, but she needed some further neurological studies, including a lumbar puncture, possibly with ultrasound. She needed probably evaluation of her venous sinuses to rule out venous sinus thrombosis, some other things, and she needed neurologic follow-up. So I tried to directly contact attending physicians, et cetera, and spent the day really trying to reconnect her with our community. We talk about everybody needing access with what is our quote unquote safety net. And I was told, quote, she has no insurance. The only way to do anything is through the ER. Sorry. So now we have a young 24-year-old working gal in San Antonio that has already had one trip to the emergency room. And the only way for her to access not only initial care, but follow-up care through our safety net is to return to the ER. And that was extremely not only disheartening, but eye-opening to me. And it showed that we, as the direct patient care physicians, have become the safety net, have become the access for our patients. The second story was during the year that we were not allowed to operate or treat patients that were not deemed emergent by bureaucrats. we have developed a severe backlog of patients who went without surgery, without care. And also we created a lot of additional problems, and many of you in primary care see them, such as the mental health issues and so forth. But I had an elderly lady, probably almost 90 years old, who had lived her life with only one eye. And her only eye had become blind during this period, and she could not see, was isolated and by herself. And even though she had Medicare, no one could see her for months. She was sitting blind. She couldn't hear well. She couldn't communicate. So her daughter found out a bit about me, brought her to me. Within 2 weeks, I operated on her only eye at a very low cost. You would be shocked, which she chose to pay. And the next day she was 20/25 in her only eye. She was crying. It was a very high moment. I'm very humbled to be able to do that. But I was very thankful that I had the ability to do that. And let me tell you that had I still been participating with Medicare, I'm not allowed to do not only charity care, and true charity care is not compelled, it's done from your heart. And I love that that is part of the mission of this group, to be able to do that. And I choose to do that as often as I can. But, if she was in a Medicare HMO, and so many of the people have managed care Medicare plans, if I was a participating or non-participating Medicare provider, it would be fraud for me to provide the care for her outside of her HMO. So she would be stuck waiting for months, blind, isolated. It's really almost a cruel system. So as a direct pay doctor, we are actually providing a great service. And it also saves money. When you think about this, it saves money from our government, because we are doing things at a lower cost without all of the money going out to middlemen, directly for the patients, efficiently, expediently. And most importantly, the patient is in the center, controlling their dollars, controlling their access, and controlling their choice. So I wholeheartedly support this group. I am so thankful that Congressman Roy is at the level that he is, with the understanding of the healthcare plight of the American patient and physician today. And he gets it from the policy standpoint. He's willing to listen to us as his constituents. And most of all, he now has risen to a position where he has a true voice and ability to impact and bring forth policy that could really be life-changing for our patients, our country, and our future. So I appreciate this opportunity. Thank you, Roger and Shankar, and all of the physicians. And this, this isn't just physicians. This is every other kind of care. It's access to medications, rehabilitation, all of the resources that we all know are so desperately needed for our patients. So thank you, and I'll pass the baton to David. I hope I haven't been too verbose.
No, thank you, Chris. It's always good to be alongside you and get to talk with you. And Roger and Shankar, thank you for having me on tonight. It's an honor and a privilege, and I'm thankful to be a part of this event and see all these participants that are here, part of the FMMA group. I can't tell you how important this message is. Not necessarily just the vision and the platform that MMA offers, but these stories that we're being asked to give. Even if Congressman Roy hadn't asked them, I would encourage you to start collecting them and cataloging them and using them, because I'll tell you, they are the most powerful tool that we have, and we don't use them enough. We have a lot of facts and figures and data points and PowerPoint presentations, but they don't compel the heart like a story. And let me start by telling you all one before I tell a little bit about my history. Some folks from Houston, where I used to live, reached out and they said, David, my husband was just laid off during COVID, and we don't have health insurance any longer. It's been a real problem. We're concerned, and we don't know what's going to happen if we get sick, because we can't see the doctor because we don't have insurance. Which that is something that I hear a lot, and it really surprises me. People think they can't go to the doctor because they don't have insurance. And so I got them in touch with a direct primary care physician there in Houston. They went and saw him, and they said, this isn't real. This is wonderful. We're paying a low monthly rate, and we get to see the doctor as much and as often as we'd like. And he's taking care of our needs, and he's interested in our well-being and looking after us proactively. And they they were beside themselves because they'd never heard of such a thing. And they said, David, well, what if something bad were to happen? What if we need to go to the hospital? I said, well, there's a group that I use, but there are a number of cost-sharing organizations. I happen to use Sedera myself. I'd be happy to introduce you to the folks there. And they looked at all the different ones. They looked at MediShare and Samaritan and you name it. And they ended up using some Sedera. And they signed up and got a plan for their entire family. I think there's 6 of them. And they picked the plan that had the equivalent of they don't call it a deductible, but it's the equivalent of a $500 deductible. Still a low monthly rate, even with an out-of-pocket amount that was that low. Of course, you get those kinds of plans hoping to never use them, right? It's insurance. Well, this morning I get a phone call and they said, David, our youngest was on the soccer field and he severed his Achilles tendon. This is a kid that was about to get an athletic scholarship as well going into college. So it's hit their family, but they said, we got this Sedera thing, but now I'm really worried that we made a mistake. We should have stuck with Blue Cross. I don't think this is going to work out. I said, well, why? Because I don't know what to do. I said, well, here's the thing. Call your DPC doctor, get him involved, call the folks, and I'm happy to help as well. So we called up the organization and they said, sure, yeah, just go and find a doctor, have them look at it and confirm it, and get a second opinion. They use an organization called Second MD, and they went through the process. And they said, well, we don't know, which doctor to use. Where do we go? Is there a network? Which a lot of these folks don't use networks. Networks are a tool invented by insurance companies so they can manipulate the market. They're controlling supply and demand. And so if you really do have a great option or you have a great platform for offering coverage, you don't necessarily need a network to function effectively. So they had no network. So they said, well, where should we go, David? And I said, well, there's a gentleman that I know of. It's Texas Medical Management, also known as Texas Free Market Texas Free Market Surgery Center. And they said, sure, yeah, we can take care of you. They have a surgery center now in Houston, and they're already scheduled to get the procedure done. And it's going to cost them $500 for the facility, for the surgeon, for the anesthesiologist, the radiologist, you name it. They've come out of pocket that much. That's what they signed up for, and that's what they got. Now, tell me how often that happens when you have a Blue Cross and Blue Shield plan. Sometimes it does, but oftentimes it sure doesn't. And what we have in this country is an addiction to insurance. When you go to DC and you talk to staffers, or even in the state of Texas, and you talk to the folks that function as the healthcare experts, many of them have never worked in the healthcare industry. And one of them, God bless her, I was talking to her boss, and afterwards she said, I want to show you my diagram of the healthcare industry. It was very intricate, but there was a triangle in the middle of this diagram. There we go. There was a triangle in the middle of the diagram. And at the top point, it was insurance. One of the bottom points, it was pharma. And at the third point, it was hospital. And this was the healthcare industry. And she looked at me and I looked at her and I nodded my head and I said, well, where's the doctor and the patient? They lose sight of the basic building block that makes up healthcare, which is the doctor-patient relationship. That's what we need to put forward in the forefront of our minds and in our policy and in our discussion and in our stories. As a way of introduction for myself, and maybe a little bit too late at this point, I was a hospital administrator, CEO for nearly 20 years. And patient care was very important to me, which is why I'm no longer in the hospital business, because it's very difficult for that to be the case. And because I saw that politicians really knew very little to nothing about healthcare, I decided I was going to run for office, and I became a congressional candidate. Believe it or not, that's where I first met Chip Roy. I met him at an event where he was speaking. He was there on behalf of his employer at the time, but he started talking about healthcare, and never before had I heard anybody talk about it the way that I talk about it. So I went and picked his brain, and that ended up being about an hour and a half conversation. And he was so generous with his time. He had to drive back to Austin, but we had to talk anyway. So I knew him well before he's gone on this journey to become the congressman of Texas 21. And I'm thankful that he's there because he does get it. And he does care about patients. And he's not about enriching the middlemen and the insurance companies and focusing on a one-size-fits-all solution. Because for those of us here in this room that are a part of this industry, what do we know about healthcare? We know that it's incredibly local. Even as a hospital administrator, my primary service area was 1 to 3 miles. You all as physicians, it's your communities. That's who you're taking care of. Those are your people. And forgive my dogs, but those are your people. That's who you're caring for. And to for these elected officials to say that we know what's best and we're going to be able to do it from Austin or DC or from wherever they are, that they want to implement these policies that address large swaths of the population, that's just completely wrong-headed. I'll also say, I said earlier that we have an addiction to insurance. That's especially true in the halls of government. Somehow people are going to get access and better healthcare if we give them a plastic card to go into their wallet, albeit it's a really pretty card. But that isn't what provides healthcare. That's not what provides access. Let's talk about Texas Medicaid. We're here in Texas, right? We have nearly 600,000 people who are eligible for Medicaid who do not enroll. And in large part, that's because we only have so many physicians that take new Medicaid patients, actually a third of Texas physicians that take Medicaid patients. So where do those patients end up when they're sick because they can't get an appointment? They go to the ER. And all of us know that's not the place to get primary care services. Let me for those that say, well, that's all speculation. Let me give you the numbers. Health and Human Services Commission here in Texas has provided us with the data. In the state of Texas, we spend $750 million a year in Texas emergency rooms on Medicaid beneficiaries for non-urgent care. We can do so much more for these folks that are the most vulnerable by having them paired with a primary care physician that is vested in their health, that is able to correspond with them via telemedicine because of the limitations they may have. You know what group of physicians already do that and do it really well? It's direct primary care. That's what they already do. And so that's why that's a model that we're focused on and that we're trying to build on. But primary care is on the whole is what we're looking to improve upon and to build. Again, like Chris, I could keep going on and on all night, and I have plenty of stories, Roger and Shankar. But I'll hand the floor back over to you all and guide us as to what you'd like for us to talk about.
Thank you, David and Chris. Are there any other listeners on the webinar that would like to comment and share a story or ask a question about what's been said or how we can get the message in?
I'm happy to tell another story. Well, I see a hand raised. If I may, I got one short one, and then we can go to Miss Toddy over there. Earlier this year, I was I had to go in for. I'm getting a little feedback. I apologize. I had some pain, and I called my direct primary care doctor. It was on a Saturday. I was actually doing some yard work, and I had some shooting pain in my shoulder, and I thought, well, that's never a good thing. So I called my DPC physician, and he had me take my blood pressure, and he said, you know what, David, based on what I'm hearing from you, I think you need to go to the ER. And he said, let me know where you're going and when you get there. And I pull into my wife drives me there. We're pulling into the parking lot. I text him that we're there. By the time they're rolling me back into the ER, my physician, I hear him, the ER doctor, talking to my DPC physician. The ER physician comes in. He says, I've got a plan. I've talked to your doctor. This is what we're going to do. And over the period of 4 to 5, 6, let's just say 6 hours, they were in close contact. I think they were on the phone at least 4 different times. We had the tests done that were needed. Any labs that I had done most previously, they were shared with the ER physician there. So there was no extra waste. There were no unneeded testing that was done. And when all was said and done, I was in good shape, and it was just more of a muscular issue, and thankfully not anything more serious. I went to go pay, and I said, and because it's me being me, I said, had I had insurance, what would the bill be? If I had Blue Cross, for instance, and they said it would be $1,850. And I said, well, thank goodness I don't have insurance. I'm uninsured. How much is the bill? And they said, oh, it's $750. So it's always good. I use that, I tell that story for a number of reasons. Number one, I had an advocate. I had a partner. I had somebody that when I was in a more vulnerable state that was there on my behalf, quarterbacking the situation because he knew me and he was vested in my care. That was important. Secondly, always ask for the cash rate. And thirdly, just because you have insurance doesn't mean you're getting a better deal. So I think that those are important things to take from that. But there were some other people that had their hands up, and I'll pass the baton. I believe Miss Sabina had a story to tell, or had her hand raised anyway, but I don't see her camera on any longer. There you are, and you're still muted. You're on mute, Miss Sabina.
I don't really have a story to tell. I've been in healthcare forever and ever and ever. I started when I was about 15, and I've seen it change and change and change. The question I have and the interest that I have, or not only of what all the things you're doing, which I think is tremendous, and I thank Shankar for inviting me. Are you, as a group, doing anything for preventative care?
That's a great point. And so I think how it relates to the group is access. Okay, so I'm a DPC doctor, so we are really all about prevention. When we have a new patient sign up to our plan, we reach out to them, we encourage them to come in right away and establish care, so we can learn about where their healthcare is at, and do screening labs and vital signs, and look for any thing that's out of the ordinary, so we can get in front of it. And then we also work with employers a lot, and when we have an employer group sign up to our plan, we have a system, and we have dedicated staff to reach out to each and every one of them, establish contact, and say, hey, look, come on in, let's do your biometric screening, let's get some baseline labs. So we're already reaching out to them, and our whole goal is to help manage the population health of that employer group, of that company. So we are so big on prevention. So we are.
Thank you. That's what I wanted to know, because that's the thing that seems to be missing the most.
Yes, it's so important, and access is so key to that, because it's like it's already been mentioned on this call that just because you have insurance, you may not even have access because it's expensive. You haven't met your deductible. So folks tend to put things off and not go in. So
Thank you.
you're welcome.
Thank you. I saw Antrea Ferguson's hand here earlier. Antrea.
Thank you, Shankar. Good evening, everyone. My name is Antrea Ferguson, and I've been involved now for a couple of years with the FMMA as one of the leaders as well, spearheading this free market movement for medicine in San Antonio, hearing webinars and seminars, watching documentaries and talking with doctors all over the country, flying here and there and being very diligent about getting the right information to the right people, the right time with the right message, like elected officials, and really trying to connect all of the people that Dr. Moczygemba talked about from the beginning with the buyers and the sellers and the vendors. But no matter how many times I read the statistics, and I do read the statistics, it's always, always different when it's you, when you're personally affected by a medical situation. And it's like Dr. Held said, it's not only the physicians who are affected, it's those of us who aren't providers. We patients are consumers. So we all have stories as consumers where we're taken for a ride. You go here and you buy a good, and then you go somewhere else and think, I could have saved $34 if I would have went to HEB instead of Walmart. And in my case, I had a little bit more than $34 that I could have saved had I not gone the route that I did. And it was with a wisdom tooth surgery that I needed to have performed. So I'm totally good on primary care. Direct Med Clinics got me covered. Thanks, Doc. But as for dental insurance, I really didn't know anything about that world. I had dental insurance, which paid for my dental visits, and that's good. But since I ended up needing to have a wisdom tooth surgery, I suddenly found myself needing a specialist, and I didn't know much about that world. My dentist pointed me to the referral sheet for a surgical center here, and I recognized a name that was Dr. Mark Haverkorn. And I thought, oh, well, that's great. I had come to know Dr. Haverkorn from one of our very first FMMA meetings in 2019. And the facts are that he no longer worked at that particular surgical center that was listed being in network. But just because I saw his name, I got curious, and I thought, well, why should I stick only to those that are in network specialists when I very, 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 very much trust this individual? I know what he stands for. I know he believes in the free market, and he's got all the price transparency that one could ask for with a list of everything on his website, down to the anesthesia, you know, before you walk into the door, when you call them, everything is consistent. So I had a choice to make because I still wanted to. Now I have an opportunity, not just as somebody, you know, fighting for what I believe is right, you know, going out there spreading the word, but I have an opportunity now to test the waters as a consumer, as a patient myself, to test out this theory and see how it works. So I had a choice to make. I called my insurance company just out of curiosity to try to figure out how much it would cost me. And I'll spare you the headache and the 6 hours that I spent trying to figure out that information. I still couldn't get a straight price. To this day, I can't get a straight price, but I got pretty close. I got 3 different prices ranging from $800 to $1,400 to get 4 wisdom teeth removed from 3 different insurance representatives. Get this, same insurance company. So none of these prices included anesthesia. And you might think, well, that's not too big of a deal, but it was going to be at least a couple of $100s, but they charge you in increments of 15 minutes. And nobody knows how long your surgery is going to be. I thought, well, what if something happens or there's some kind of complication, or I don't know, why can I not just walk out here thinking, man, could have saved 34 bucks if I would have went to Dr. Haverkorn instead, but I knew that it was going to be much more than that. So the point is that calling again and again and again and again, this isn't the way that you really want, you shouldn't want consumers to have to go on a hunt to find your services. And I had called River City OMS, who told me the dental codes that I could use to talk to the representatives of my health insurance company, which is the only reason why I got as close as I even did. But dealing with specialty care, I think that a lot of people are just lost, especially maybe even more lost than you would say with primary care, because you go for it's not maintenance and checkup, you go for a specific reason, right? So here I found myself in this world just trying to figure out what was going on. And one of the things that I will never forget, because if you think about value and how the price and quality are connected, they couldn't even vouch for the provider or the specialist who was going to do my surgery. And they even told me that. That was the only thing they were transparent about, was that they couldn't guarantee the quality of the service that I was going to get. And I thought, you know what? Thank you very much for this conversation. I've got all the information or lack of information that I need. And I ended up calling Dr. Haverkorn and saying that, I have made up my mind. I want to get this in. And sure enough, I mean, $1,025, like, in what world can you know that, right off of the bat? And I think just, again, knowing the quality, I think this is a truly self-selected population, because people who are interested in being transparent, who are interested in being honest, do good work. And they're not afraid to be transparent because they do good work. So they want, go ahead, yeah, share all of my prices. And then that stimulates and creates the competition. So it was nice to, breathe that sigh of relief that I wasn't going to get part of my jaw taken out as I got my wisdom teeth removed, and I wouldn't wind up in financial ruin, because I knew what was going to happen. But I know that there are a lot of people who are not as lucky as I was, who aren't involved in the FMMA. It was a complete accident that Dr. Haverkorn's name even appeared on the referral list, because he had since left that place to start his own practice. But yeah, I guess I am a testimony. I just shared my testimony of what being involved in this organization does, and what a huge difference it makes. Arguably, I should have just saved the 6 hours and just gone straight to him. But now I can tell you for myself that it really works. The care was fabulous. I had all of those calls too. The aftercare calls were amazing. I just felt like it was VIP service, and that's my experience. So I hope that everybody gets a chance to network and get to know who does what. And we really got to put more specialists into this group too. Thank you for your time.
Your story reminded me of something that occurred with Chris. I had somebody tell me, David, we need surgery on my husband's eyes. Both of them, he needs both eyes done. And we just can't afford it. Our deductible is so much, and it's going to be, in excess of our deductible, and we can't even afford that. And I said, let me check with a friend of mine who's an ophthalmologist in San Antonio. And even though they were in Houston, they were willing to make the drive. So I asked Chris, I said, Chris, do you have prices for this particular surgery? And I'm sorry, I don't remember what it was. And she sent me her prices by text, and I forwarded it on to her. And she was the patient was almost angry. She said, David, he needs to have both eyes done. This can't be the price for 2 eyes. We're not talking about just one of them. I said, and I had to go back to Chris. I said, Chris, is this for 2 eyes or one? And she said, David, it's for both eyes. They were shocked with the price, and they were so happy, and they drove. I believe they drove. Yeah, they did. And because they called me to say how nice Chris was, and she really is in real life, not just on TV. But she did such a great job, and it was at a rate that was affordable, that was well below what their deductible was going to be.
Well, always when Antrea spoke about 6 hours of research she conducted, working with her, I will always think of her time as time is money. So I very much think that there is huge value in being able to go to a website, for instance, and find concrete pricing. And if you go to said Dr. Haverkorn's website, rivercityoms.com, I think it is a poster child example of having all the services listed and having very specific pricing. But for those of you who don't know, Dr. Haverkorn is actually with us on the call tonight. So I would very much like to hear from Dr. Mark Haverkorn.
There we go. Okay, sorry. Thanks for the introduction, Shankar. Sorry, I don't have my video camera up at work. I just don't have a camera on my computer, so I'm watching you guys though. And thank you for the kind words, Antrea. Dr. Held and I think Dr. Held and I are very similar in that we're both surgical specialists doing this direct care model. And she mentioned the Surgery Center of Oklahoma. That's where I got my idea from. I was listening to a random non-healthcare podcast probably 5 years ago, and a guy in Canada mentions that he had a neck mass that he needed biopsied, and nobody in Canada would do it anytime soon. And he had heard about the Surgery Center of Oklahoma, went down there, got a biopsy. Well, he's got lymphoma, and he was able to start getting treated when he would have been on the waiting list in Canada. And I heard about this and said, what are you talking about? I got on the Surgery Center of Oklahoma's website. So this is genius. They've got all the prices right here. It was almost unbelievable. And then that eventually led me to opening my own practice and just modeling it after them. But I told Shankar, I've got a couple of stories. I'm sitting here doing what all physicians love, which is writing notes tonight. And I just wrote a note about a patient that I saw yesterday just to take out a tooth. She's having a painful tooth, but interestingly enough, this lady is 43, lives in rural South Texas, and was recently diagnosed with diabetes based on a UA for something else. And I said, well, you're not taking any meds? And she said, no, I've got to get some insurance before I can afford any medications. Yeah, I see Roger shaking his head right there. And and we all know insulin prices have jumped in just the last few months, but this lady probably doesn't need to start insulin. I asked her about what her A1C, I asked her about her diabetes, and she wasn't super knowledgeable, but she knew that at least she didn't think she could afford medications. And I tried to give her some resources for some places to maybe get lower cost medications. But that's one story there. Just yesterday in my oral surgery practice, I run across an uninsured patient in need of medical care. I shared with Dr. Moczygemba, I don't know, I guess it was last week. Earlier this year, I got the highest estimate I'd ever seen to remove a set of wisdom teeth. And it was a patient who had dental insurance, much like Antrea was talking about, gone to another oral surgery practice, and the cash price was going to be $6,000, but luckily she had dental insurance. And so that knocked her out of pocket down to about 30, or actually I think it was like 4,200. This is with insurance to get 4 wisdom teeth removed. And that kind of stuff is what allows my practice to flourish, and why people, even with insurance, will come see me, because even with insurance, they save money seeing us. And then yesterday, I treated a young man. We were talking about the ER earlier. I treated a young man who was in the ER this past weekend with dental infections. It's somewhat rare, but both sides of his face were swollen up. Usually I see people with one tooth, it's one problem, but he had an abscess on each side of his face. Doesn't have insurance, doesn't think he can afford treatment anywhere, so he's been putting it off. And of course, everybody's kind of scared of going to the dentist too, so that's a part of it. And he finally, after a few years of battling this and acutely, he just couldn't deal with it anymore. He goes to the ER, and they give him antibiotics and tell him to come see us. Well, I think we charged him $775 yesterday to put him to sleep, take out 2 teeth, and drain actually drain 2 abscesses. And I'm happy to do that. I mean, I was happy, my staff was happy, the patient was happy, but the poor guy, until he had heard about this practice and what we're all pushing for, he didn't even know that was an option. So those are my stories anyway.
Thanks, Mark, for sharing that. I want to share a little bit from an experience I had this morning that kind of reaffirmed what's going on in the insurance world. So as part of ACA, there's this thing that was written into that called the medical loss ratio. And what that says is that insurance companies are only allowed, they have to spend 85% of what they collect on healthcare premiums on actual healthcare. So the remaining 15% is what the insurance company gets to keep for administration or profit or whatnot. So if you look at it from their perspective, if they want to make more money, what do they have to do? They want to increase their 15%, they've got to increase what? More spending, right? So if they're collecting $100 on a insurance premium, they've got to spend $85 paying the hospital, the healthcare providers, whatever, to keep their 15. If they want to make more, how much? Or if they double a healthcare spend to $200, well, then they get to keep 30. So you see that it's almost like written into the ACA law, which is insurance, that if you want to make more money, healthcare spending has to increase. So that is another thing that we're trying to work against. And you can imagine the huge forces trying to keep that in place, right, David? David Balat. So another thing I just wanted to mention is that just thinking about the folks on this call, we have some specialists that are walking the walk here, and we've got other patients here. We've got providers. We've got a group of docs from South Texas Renal Care. They're in the process of rolling out an app that's going to provide a platform for all the providers to post their cash prices. So what a wonderful thing that we have developing here. So it's kind of it's exciting for Shankar and I, because it's a realization of what we've been trying to do for the last couple of years, is to bring folks together like the docs that are doing the thing, walking the walk, and then the brokers that get it, like the brokers that we were on the phone with this morning, and then folks in a position like David Balat, that can help make our voice heard and rally the troops. We really, I hope that you guys can feel the passion here in this meeting, and that you can help us raise this to another level, which we're slowly doing. We need all the momentum we can get. I think, David, you were going to say something.
No, I was just going to compliment you on your explanation of the medical loss ratio, the MLR, and that's exactly right. And we've seen premiums go up considerably during the time of the ACA, and it wasn't. They don't spend just the $85. The language in the ACA isn't for medical services; it's for clinical activity. And so, what does that mean? The insurance company can actually have an advisory committee or a study committee that looks into audits, and that could be clinical activity. So they can still pay themselves out of that 85%. But you're exactly right that the 15% is how they continue to grow, and that's why we've seen that increase in premiums, and that's why we've seen the consolidation of the middlemen, where they're bringing those groups in, and we're seeing because of that consolidation that the majority of their income now is coming from pharmacy benefit managers and other groups that they're bringing into the fold, because then they have a captive market. The mail-in prescriptions is a great example with CVS and CVS Caremark and Aetna. So there's definitely a problem in the current healthcare environment, and I'll end where I started. The fix is a focus on the doctor and the patient.
Dr. Moczygemba mentioned that app that I have actually downloaded already, and it's basically like an Amazon for healthcare services, which I think is a very, very critical part of creating that free market where we have equal access to pricing. And we have a representative of that company here with us tonight, actually several, but one that I see is Tim Kaufeldt, if I pronounce that correctly. And Tim certainly wants to share a story with us too tonight. Tim?
Hi all, and thank you very much for having us tonight. Sorry I'm a year late. March 12th of last year, I met with Dr. Tanguru, and she told me about your organization, and 4 days later, San Antonio was shut down with COVID, and so just about a year late to the party. But, you know, I want to start with a personal story, what I call, we always say, everybody has a Lazo story, but my personal one is very similar to David's. I was actually walking my child out of school, slipped and fell, and I couldn't move my arm. I heard something crack, couldn't move my arm. I went to Baptist ER because they were in network with my ACA plan, paid the copay out the door, $950, and I knew I was getting bills later. And so I went to see my primary care physician. And he said, you know, what, the x-ray was negative, we're going to need an MRI. And all I knew in my head is that I was going to go in, give him my insurance card, which, by the way, the 1990s taught me was a credit card. But I was going to give him my insurance card, and that, you know, I was going to pay a small copay, but then I was going to get a bill for $700, $1,500, $2,200. I don't know. My deductible was $7,000 on that exchange plan. And so I told him no. I deferred care, if you will, and that's one of the problems I'm very passionate about solving now. But, you know, my doctor looked at me and he said, no, listen, you know, there's a place in Bernie, Texas. They don't take insurance. They only take cash. He says it's $350 for an MRI and a read. And I will tell you that at that moment, as a consumer, my decision was very quick. Whereas I was deferring care before due to uncertainty, I was suddenly thinking I can pull $350 together for peace of mind. You know, and we talk about price transparency as being a key determinant here, because none of us hesitate to spend $80,000 on an SUV or X on a bottle of wine or whatever, because we always know, or cosmetic surgery where everything's bundled. People will not hesitate, but they'll live with chronic conditions because of the fear. So as life would have it, a very good family friend of ours, our daughters grew up together, Dr. Mazzani, he's on the call tonight. We've known each other socially for over a decade. And he's always been an innovative, forward thinker. And he said to me, he said, hey, man, I'm in your business because I come from tech and startups. I'm a 20-year entrepreneur. And he says, hey, I'm in your business now. I have an app. And he told me about it. And I didn't grasp it at the time. But the more I thought about it, and we came back together a year later, and he said, I want you to, you know, I want you to help me make this vision. You know, we've done a bunch of work. We've done some research. Help me make this vision. And so we set about in August of 2019 of building this app called Lazo, L-A-S-O. The idea was always that we would be able to provide the user price transparency, a convenient way to book the appointment, payment through the app, and then for the providers, the ability to grow their revenue without increasing their overhead, but also to help facilitate that direct patient to doctor relationship. And I will tell you, fast forward, we built the app, we took delivery of the MVP in February of last year, and then COVID hit. Well, obviously the business model was busted. So what we did is we used it to facilitate COVID testing appointments. We've now come back to the market, and thankfully we've met Dr. Moczygemba a couple of weeks ago. He explained FMMA, and it was if he was repeating back to me the Lazo mission. There's a lot of ways to spin it, but the bottom line is this: we're all in the same vein here, and that is basically that we want to directly connect patients and doctors with no middlemen. We want patients not to defer care due to cost uncertainty or convenience. And we know, and somebody mentioned it a minute ago, and I believe it to be true. I know that we visited with Dr. Haverkorn a week ago, my partner Noah, and I will tell you that there are providers out there that want to deliver healthcare in a different way. And the funniest thing about talking to people about this app is that as we've talked to providers, the problem hasn't been getting a yes. The problem has been figuring out how to deliver direct access healthcare. And so we're very thankful. We launched today with our very first provider, Bone and Joint Associates of San Antonio. They are offering X-rays bundled with a consultation. They're offering X-rays. They're even offering DME with the fitting on there, but it's all cash price. The part of the Lazo promise when they sign it is that they will not bill insurance, will not bill Medicare, nor will they charge any more for that particular service. Now, to David's point, once you get that service, maybe that X-ray shows that you've got, a double hairline fracture in your tibia. That's where I say that's what insurance is for. Because deductibles specifically have risen 162% since the passage of the ACA. And currently, right now, almost 65% of employer-sponsored insurance plan holders are functionally uninsured. And if you haven't heard that term before on this call, if you have less in your savings than your deductible, you are not technically covered by insurance. And so with Lazo, we know we can't. We know that we cannot solve every problem, but really what we're trying to get down to is through price transparency, convenient booking, the ease of use of a mobile app, shopping in a way that we're all used to shopping for everything else in our life but healthcare. We hope to, if it has that one single mom that wakes up with a stomach ache and goes and gets it checked out, instead of ending up with appendicitis in the ER a week later, we've done our job. And we all know that care deferment leads to medical debt. Medical debt leads to 67% of all bankruptcies in the US. Right now in Bexar County, I want to share this statistic with you. For people at $36,000 a year or less, there is currently $100 million of medical debt in collections in Bexar County. 1 out of 4 Bexar County residents has more than $2,100 of debt in collection for medical expenses. It's a huge problem. We're a small part, but I love the fact that your mission is our mission as well. In any way that Lazo, that we can use this as a platform to help facilitate your mission as providers, as specialists, as brokers, that's what we're here for. And so thank you guys for the time, and I really appreciate being able to share the story. So.
And if I could follow up on I think it's important to follow up on what Tim just said about the medical bankruptcies. Most people don't understand or recognize that the majority of people who are going through the bankruptcy process because of medical debt, they have insurance. Mm-hmm. It's not because they're uninsured. They have insurance. Mm-hmm. Now, isn't the promise that we're given on a regular basis that if you have insurance, you're protected? That's not bearing out in reality.
Right.
So we have to fundamentally change the system that we're talking about.
Yep, I agree. And it's happening. All the trends, I believe, are in our direction. The more young physicians that I speak to that truly got into it to practice medicine, they're looking for alternatives like the one that Dr. Moczygemba put together, or Dr. Tanguru, with direct primary care. The model is amazing. Lazo's piece of the story really is to be a technological platform to show patients, to give them options. And I want to say that, GoodRx has done an amazing job of selling this story on the pharmaceutical side. And, what we want people to know is that you have options. I got an anecdote from a very large corporation here in Texas. Their TPA actually has a full-time employee in-house. When somebody books an appointment using Blue Cross Blue Shield insurance, this person calls around and gets cash prices from all the places, calls the person who booked the appointment and offers to book that for them. That's what our app does. And I'll tell you that, I'm blessed in my life. I have a great healthcare system. I have a concierge doctor. If I'm sick tomorrow at 8 o'clock, I'm in his office by 8:30. He's directing me to cash prices at Baptist M&S for an X-ray, whatever. But that should be democratized. You should not have to achieve things in life or, you shouldn't have to work for a large corporation to have the benefit of. So we really want to just decentralize this piece of healthcare in terms of the things that can be delivered retail. And so anyhow, thank you for the time. And thank you, David, for the comment.
Tim, I think that's such a great, fantastic idea for an app. I'm launching a new website next week called isurgeondirect.com. And I'm trying to put little banners and links up there, like to FMMA and that sort of thing. So I'd love to connect with you on that.
Yeah, sure.
I think one thing we're really lacking in San Antonio is access to direct pay rheumatology. Access to rheumatology at all. We can't get people in within 6 months. And we've called around and they're like, we don't offer cash prices. You have to have insurance to see us. So it's shocking to me that we actually have a specialty. And so if anybody knows about that, we actually have a specialty that we can't find anybody that will see cash pay. The other thing I wanted to make 2 comments is that when you're using your insurance, oftentimes you're restricted. And with Medicare, you're restricted to what they consider covered services. So for example, in ophthalmology, they'll cover a very, very basic implant. Anything that's available that might give you better vision, this sort of thing, that is a non-covered services. And then over and above, even if you go to someone who is totally invested, participating, whatever, they can charge extra. And what we're finding that in some cases, what they're charging over and above for non-covered services is more than if you come and get top of the line from a direct patient surgeon with choice, when you have choice. And I think then on the other side of the coin, when more and more physicians are working for employers, private equity, big corporations, big insurance, I think they fear reprisal and then think of if they go outside of any sort of boundary of pulling down a drop down of what they're allowed to prescribe or what they're allowed to do. And I think when you lose the ability to practice medicine and start doing algorithmic cookbook medicine, then that's also a detractor and a place where you're going to want to be able to. We talked earlier about value and choice and access. So I think that what you're doing sounds great.
Awesome. Thank you.
So I wanted to say one more thing. We're getting short on time, and we have another wonderful influencer in this meeting in David Vequist. I'm so glad that he could join us and be part of our team. And David, I don't want to call you out or anything, but if you've been sitting there taking it in and have something that you'd like to say, I would just like everybody to know who you are and that you're part of the team and that we're going to be building more momentum together with David. David, please introduce yourself to the team.
Oh, thank you. I'm very similar to David, our speaker. I'm a former hospital executive and also an Ernst & Young consultant. And I dropped out of that about 20 years ago, and I've been a professor at the HEB School of Business and Administration with the University Incarnate Word, and also the founder and director of the Center for Medical Tourism Research. You're probably all familiar with the idea of medical travelers, both domestic and international. It's really patient consumerism. It's patients deciding to look for opportunities for the best quality and value and care that they can find wherever that is. And as you've probably seen over the years, as you heard about the Oklahoma Surgery Center earlier, oftentimes DPC practices, because they tend to give very good quality and also very good value, are sought out by both domestic patients and international patients sometimes, as I think we heard an example from somebody in Canada. The other trends that we're seeing in healthcare in terms of macro trends that involve people traveling and people deciding to take control of their health by looking at it as consumers is this wonderful, amazing trend that I'm loving, which is domestic medical tourism of employers direct contracting, also called bundled contracts, with centers of excellence around the nation. What I love about this is similar to how DPC brings back the relationship between the physician and the patient. The direct contracting gets the employers who are typically self-insured, instead of giving their money to a third party, what they do is they come up with direct contracts with the best providers, perhaps within their area or region or potentially state or country or wherever. They go out and seek them out, develop relationships with them, have direct contracts, and you have now this relationship with a wonderful provider for their employees, because the employer really cares and they really want their employee to be well. They want them to come back to work. They want them to be able to function, be productive. And so almost everything good that's happening in healthcare, not only in the United States and around the world, including the value-based healthcare models that are evolving, are truly American ideals, and they're free market ideas. And so what's happening right now on this phone call, and some of these wonderful people, some of these physicians with DPC practices, they're really at the forefront, the point of the spear, if you will, of what is going on in healthcare that's good. Everything else, everything the government's doing is bad. Everything the free market is doing in healthcare is good. And that includes telemedicine, by the way. That's basically all I had to say.
Thank you, David. So we're quickly running out of time. Is there anyone else that needed to say something that didn't get a chance? If not, I'll go ahead and wrap it up.
Yeah, if you don't mind, Dr. Roger, I just wanted to chime in real quick.
You bet. Thank you, Byron.
So listening in, I appreciate everything that you guys are doing for the free market. I'm actually a broker. I work in the insurance industry, but I actually met Dr. Roger because I also work with a direct primary care group that works nationwide, providing direct primary care services to employers to reduce costs and things of that nature. And just want to share a quick story of my wife. We actually have a limited benefit plan, and our insurance is phenomenal. She recently had a herniated disc. With our plan, it pays $160 per physician visit. We also get $200 for specialist visits, $700 for MRIs, things of that nature. And over about a month's period of time with this herniated disc, she had a chiropractic consultation. She had 6 adjustments, a lumbar spine MRI, 2 teledoc visits, which were free. She had a specialist visit with an orthopedic surgeon over here in Memorial Hermann in Houston, X-ray there, and then a second specialist visit. Now it is a PPO network, so she can go wherever she wants, when she wants. And having said that, she got all of that care paid for 100% and ended up with $1,215 in her pocket that was just left over. And her premium every month is $111. So it's not that insurance is broken. It's our understanding of insurance, what healthcare does, what these insurance companies do under the ACA. And a lot of it is just really helping people to realize that there are other options. And it has to start with primary care. It has to start with getting people to a doctor and making sure that they stay healthy. But that's the education part of it. And I do appreciate everything that you guys are doing to make that available to people, because a lot of people out there are struggling to pay a deductible or go to the doctor because they're paying so much for their insurance in the first place.
Byron, thank you. Byron he fills such a wonderful niche for individuals and small companies. Like a doctor's office like myself, we have a small number of staff, so we're not a good fit for a big plan, but Byron was able to help us get our staff covered. And I used the service several months ago, had a specialist visit, and actually got a check back from the insurance company. So wonderful, refreshing insurance experience through the company that Byron is connected with. I would encourage you guys to reach out to him if you know individuals or small companies that have a need for a higher level of care beyond direct primary care, which there are a few of us kind of docs around. And so to close, I just want to say thank you again to Dr. Held and David for speaking to us, and all of you that joined in on the call. We have some influencers here. I hope that you will stay in touch with FMMA and share what we're doing with people that you know, and help build the momentum here in this community to create this value. As we do this, we're going to be noticed. We're already getting more and more noticed, and we're attracting more and more influencers to the team. And with the help of the Congressman's office and what he's doing, it's so important right now. So I think, Shankar, we can probably leave a link for folks on our website, the FMMA San Antonio chapter website. If you come across some patients that have a story that needs to be told, or you want to share one of your stories, if you didn't get the link already, we can leave it there. I would just encourage you to take the time and do that. I've already sent tons of stuff to the Congressman's office, these kind of stories. But let's stay in touch, keep together, and share the stories, and keep building this momentum for this good cause. Okay, well, thank you, Shankar, for being my co-founder of this chapter and all the work that you did, and Antrea to put the meeting together tonight.
Our pleasure.
Okay, then we will go ahead and end for the evening. Hope everybody has a great night. Okay, bye-bye.
Good night.